Hello everyone. So today I'm going to be presenting on anxiety disorders and recovery, along with Fabiola, Isabel, and Nancy. To start off our presentation, we ask ourselves, what is anxiety? It is a normal response to stress, resulting in feelings of apprehension, unease, uncertainty, and dread. Anxiety varies in type as well as levels, and both of those determine to which point an individual is impaired. It also determines which mode of treatment is pursued by an individual, as well as the recovery plan put in place. We then went on to ask ourselves what recovery meant for each level of anxiety. For moderate anxiety, learning and problem solving are still able to occur, and so once the patient is able to overcome the feelings of lack of control and focus on the present moment, they are able to pursue and engage in recovery. For severe anxiety, all behavior is focused on alleviating anxiety. There's also a sense of scattered perception. And for panic anxiety, there is terror, loss of rational thinking, and an inability to concentrate. In these two levels of anxiety, there is a less likely of a chance for a patient to fully participate in recovery, and so the priority interventions would be to aid the patient in returning to baseline prior to engagement and participants in recovery planning. So the recovery model that we chose was the Wellness Recovery Action Plan. And we chose this model because it is individual-focused care, is used globally, and it allows the patient structure to which, if they are in pre-crisis, they are able to implement the factors that are in the wellness toolbox and figure out what works for them. If they are not able to find help in the first stages, then they can move on to the next step. So a short description we found was that RAP is a self-determined evidence-based program that helps people get through life's challenges. And this is a quote by Mary Ellen Copeland. But the factors that make up the RAP model are developing a wellness toolbox and finding out what works for a specific individual, having a daily maintenance list, recognizing triggers and early warning signs, and when things start to break down. In stage 5, when things start to break down and get worse, the patient or individual is able to use or recognize the things that work for them and use them from the wellness toolbox. And then comes crisis planning, where an individual requires the assistance of someone else or has a crisis plan in place. And so I'm going to pass it on to Fabiola so she can talk about the key recovery concepts.
These are the 5 key recovery concepts at the foundation of RAP. The concept of hope is a strong predictor of recovery from anxiety disorders and other mental illnesses because it leads to resilience during times of emotional distress. A patient who integrates a RAP approach into their life will experience an increase in hope as they gradually begin to experience symptom relief by using the tools that they have identified in their plan. Furthermore, a RAP approach reinforces like an internal locus of control, so patients gain a sense of personal responsibility to their recovery and gain self-management skills. The concept of education refers to the importance of being well informed about their illness in order to make good decisions about things like medical treatments, lifestyle choices, and their environment and living situation. Patients who are educated on their illness are more likely to self-advocate, and the self-advocacy in the RAP approach is shown by patients being able to identify the tools that best help them in their recovery. It's very individualized. And lastly, having a solid support system is very important to increasing resilience with stress and just overall lowering levels of anxiety. So those are the 5 key recovery concepts. Now Isabel will talk about our findings in our research with RAP and anxiety disorders.
So when RAP is implemented with patients with anxiety disorders, we want to make sure that the patient is experiencing mild levels of anxiety, just because higher levels of anxiety are not optimal for patient decision making and reflection, which is what the RAP builds upon. With the RAP, patients might need assistance from the nurses or their support systems to identify what interventions might be helpful to them. And so here it's really important that we don't take away patient autonomy, but rather support the patient and help them recognize more healthy interventions or coping mechanisms that they can use when they experience anxiety. Patients also might need assistance from their support system or nurse in recognizing maladaptive defense mechanisms. A lot of times, defense mechanisms are not apparent to the patient that is experiencing them. And when support systems are utilized, they can encourage the patient to find alternative ways to deal with their anxiety. Also, early stages of anxiety might not be apparent to the patient. And so when the nurse or support system lets the patient know that they are experiencing the early symptoms of anxiety, this helps the patient to engage in coping mechanisms that can help the patient prevent them from experiencing higher levels of anxiety. We want to recognize that this is a trial and error process, and it might not be a one-day thing when building the wellness toolbox. And so with that, we want to be accepting towards plans that might not work and offer assistance and support as needed when reevaluating RAP plans. So next, Fabiola is going to talk about social justice in relation to the RAP and anxiety disorders. So when we did our research, we primarily found that RAP can help with treatment within anxiety disorders and also helps with patient autonomy, which gives a multitude of benefits to the patient. So first of all, we found that when RAP is implemented, it helps decrease the symptoms of anxiety that the patient might be experiencing. And this is primarily because RAP helps to identify triggers of anxiety and allows the patient to engage in coping mechanisms that are healthy to the patient. Furthermore, we found that interpersonal relationships are very significant in the recovery process. And so when support systems are used within the RAP plan, it helps the support system to know what role they play and how they can best support the patient. And so with that, this helps to improve patient functioning and decreases inpatient admissions and reduces the cost of mental health treatment costs. And this is because support groups can be utilized to prevent anxiety from further worsening. Also, we found that while the Wellness Toolbox is a relatively low-cost activity that patients can use to help decrease their levels of anxiety. And so this helps to decrease treatment costs. And so RAP also helps with patient autonomy tremendously. And so with that, it helps increase their perception within their own recovery and enhances their confidence and goal orientation because they have a say within their recovery plan. It allows the patient to be aware of early warning signs and the steps that they can take to prevent their anxiety from worsening. It also gives the patient a sense of ownership over their own well-being, and because RAP builds upon the patient's insight and their own lived experiences, it allows patients to talk about their experiences with anxiety disorders, and when they are given the opportunity to talk about their experiences, it really challenges the stigma that is deeply rooted within society. Lastly, all the effects I listed, they help instill hope within the patient and enhances their quality of life because they have a say within their treatment and they are able to advocate for themselves.
To talk about the connection between the recovery models in mental health and social justice, I've included this quote by Patricia Deegan, the author of Recovery as a Journey of the Heart, where she states, "There is more to the recovery process than simply recovering from mental illness. We must also recover from the effects of poverty and second-class citizenship. Here she emphasizes that mental illness occurs within an intersectionality of social inequities like racism, homelessness, and as she states, poverty. By second-class citizenship, she is referring to the stigma that people labeled with mental illness face. This stigma is truly a public health issue as it causes an equal, if not greater, amount of harm to people than their own mental illness. And it also creates greater hurdles to life opportunities and decreases their willingness to seek help. With most anxiety disorders, there is this patronizing stigma of not believing that anxiety is a real problem and viewing it as something that one has to simply get over on their own, which, as we've learned, is simply not true. Recovery models in mental health aim to reduce the stigma by taking on a social justice perspective that emphasizes that people labeled with mental illness are not defined by it. They are first and foremost human beings. So we believe that our role as future nurses is to continue to spread this message and deconstruct mental illness stigma so that we can help our patients break down their internalized stigma and view their illness in a more empowering and helpful way for their recovery. So now Monzi will go ahead and talk about some weaknesses with RAP.
Hi guys, it's Monzi and I will be going over weaknesses of RAP. RAP is an amazing treatment plan for people, however, it may not work as effectively for some. One thing that we found is that it requires a certain level of commitment and motivation. RAP is really patient-driven and includes a lot of participation and self-awareness from the patient. Another is that patients may not feel well enough to explore RAP process. This may affect the level of engagement, and we saw that it had to do with the stages of anxiety the person was experiencing. Crisis planning aspect may be difficult for some patients to complete as well. This could be due to denial that the person may have, maybe believing that a certain situation was not a crisis in their eyes, or it could also be difficult for those who have to think back in time of a time of crisis. RAP is usually a multi-week program, so it just takes a lot of time both for the person and for maybe a resource-limited clinical setting. The program also doesn't teach any new formal problem-solving skills. And lastly, support systems play such a huge role for RAP, and for some patients who don't have a support system, it may be really difficult for them. So even though there are weaknesses to RAP for anxiety, there are always ways around that. For example, working on bringing a person back to their baseline and to a place where they can learn and be taught. Also making sure not only to use RAP by itself, but also bringing other helpful tools like formal problem-solving training.